Good morning. Because I'm not good in protocol, I will address every single one of you as excellencies and all protocol observed. You had the best of welcome last night with my minister and Yvonne. The two of them are unbeatable. So I will simply add that we are pleased, we are thrilled to have you in South Africa, in Johannesburg, for this very first global initiative. As you are aware, the issue of children and women's health has long been a particular interest of mine. And so I'm pleased to join you to share commitments for us together to do our best to prevent the preventable. When a family hears of a pregnancy and of a birth, the natural response is to celebrate. We celebrate the new life, we celebrate the opportunities ahead, and we look forward to watching the child grow and thrive. Sadly, in too many cases, this does not happen. It cannot happen for the 3 million newborns who die every year. Their mothers do not celebrate that child's future. This was brought home to me many years ago. I was visiting a medical center on a refugee camp. A mother was holding her newborn child. As she cradled the infant, the mother and our eyes crossed. We were aware that this child would not survive. And the two mothers in us were powerless to do anything to save this child. The child had come too late to the center, and it could not be saved. I will never forget those eyes of that mother. No child is born to die, and no mother should have to watch her newborn suffer and die in that way. Of the 60.9 million under 5-year-old child deaths in 2011, about 43% occurred during the neonatal period, in the first 4 weeks of life. The majority, almost 3 million, die within 1 week, and almost 2 million on their first day of life. We know the reasons for these deaths. The World Health Organization tells us that they are related to preterm birth complications, complications during birth, and infection such sepsis, pneumonia, diarrhea, and tetanus. Up to 2/3 of newborn deaths can be prevented if effective health measures are provided at birth and during the first week of life. However, in developing countries, nearly half of all mothers and newborns do not receive such care during and immediately after birth. The under 5 mortality rate is nearly 12 times higher in sub-Saharan Africa than in developed world. Too many of our newborn children here in Africa are dying too early. We are not reaching the targets we have set ourselves in the Millennium Development Goals. The issue of newborn health has long been a hidden challenge. However, your presence here today indicates how much this has changed in recent years. The issue of newborn health finally has a space on the global health policy, program, and research stage. I celebrate the fact that you have all joined us today. This also tells me something more important, that collaboration is key to progressing the newborn agenda. Concerted action increases impact and efficiency, and as the world becomes more interdependent, our response to issues should be integrated as well. This event is one example of such collaboration, and we also need long-term collaboration. The Partnership for Maternal, Newborn, and Child Health is the example of collaboration of this field. It is a global health alliance that joins 520 partners from seven different constituencies, including governments, donors, multilateral agencies, NGOs, academia, healthcare professional agencies, and private sector, in their efforts to promote the prioritization of women's and children's health, to support an increased coverage of essential interventions for women's and children's health, and to promote accountability for results and resources. As the incoming chair of the board for the Partnership for Maternal, Newborn, and Child Health, I will take a high interest in ensuring that efforts to improve health outcomes in reproductive, maternal, newborn, child, and adolescent health are in line with evidence. This implies medical and related health care for women before, during, and after pregnancy, as well as care for newborns and infants. However, it also means more than this. It means demanding change. There's no reason why today the act of giving life should cause death. Pregnancy and childbirth complications are the leading cause of death for adolescent girls, who are 5 times more likely to die than a woman in her 20s. Globally, maternal deaths fell by 47% during 1990 and 2010. But the lifetime risk of maternal death is still nearly 100 times greater for women in sub-Saharan Africa than in high-income countries. As an advocate for the MDGs and a member of the high-level panel on the post-2015 development agenda, I'm engaging my fellow panel members and to ask you also to continue to put this issue on top of the agenda for the next years to come. We are all affected by these losses. We all feel the responsibility to make change happen. To be honest with you, many of us have been talking about these things for many years. We know that we have the knowledge, we have the technology to counter these deaths. What has not been changing? It's our attitude. It's to put institutions to act with urgency, with the sense of imperative, not as business as usual. I'm hoping that with this plan we are going to discuss and adopt here, more than anything else, it's our attitude which has to change. Many of you are mothers or grandmothers. I am a grandmother. Please bring this to your own home. Look at your child and look at your grandchild into the eyes and say, how would I feel if this child with the knowledge, with technology, with the environment, and with the capacity which exists in the world today, her or his life would be wasted. When you take it to your own environment and responsibility, your attitudes to act will be different. Let's think of the millions of children, not as numbers, but exactly as that child who means so much to every one of us. We are aware that the well-being of women and children is a key contributor to sustainable development. It is time for every one of us to take it upon ourselves to make our own contribution to improving our world, a world that allows girls to be educated and free from early marriage, to manage their reproductive health, and to shape their jobs, lives, and families as they wish. It is estimated that 10 million girls worldwide are forced into marriage every year, which means in the next 10 years, it will be 100 million girls who will be forced into marriage. The reason I'm raising this is because this is one of the aspects which fuel child mortality and maternal mortality. As much as you are not going to be working on this, but we as elders, we are supporting a coalition of more than 100 organizations in the world to tackle the issue of child marriage. And with this, we believe also to be making a contribution to the sideline effects of what is of your specific concern. There are clear and simple measures which can be taken to save many of those newborns. Simple measures such as keeping the baby warm, using the so-called kangaroo care method of skin-to-skin contact, promoting breastfeeding, hand washing, and cleansing the umbilical cord. So all those very simple things are at the hand of every one of us. Then there are measures which a health system can offer, like vaccinations, protection against and the treatment of infection, health education, strong health services, so that women can deliver safely in health care facilities with the support of trained midwives. But we also know that maternal and child health goes beyond this. It relates to the position of women in society. We know that if we protect and empower women, we protect and empower families and society as a whole. So women's empowerment is closely related to, but goes beyond gender equality. Women's empowerment relates to a woman's ability to make choices of her life and her future, to have the rights and ability to make choices concerning use of resources, rights to land and equal economic opportunities, control over their personal situation, including decisions regarding fertility. The responsibility is now ours to stimulate and to implement this change. We have immense amount of knowledge, resources, and influence at our disposal. We must work through partnership to focus on implementation of the various commitments that have been made and to hold various actors accountable for delivering results. We know what to do to improve the health of women and children. Let us act on our knowledge now for the sake of every woman, every child, as the Secretary General has just mentioned. Let us think of all these babies born in the world this morning. Let us celebrate their births. Let's have with their parents the hope for their children. And most importantly, let us all do our part to shape that future so that each of those children has a good start a healthy start for the newborn of the world. I thank you.